So let's get to our questions. Rob McCartney, KETV, when will the fully funded CARES Act benefit of 13-week unemployment extension for those who have reached their 26-week limit be implemented? That is supposed to be, Rob, that software is supposed to be implemented tomorrow, and so the payments will get processed over the weekend. So thanks for asking about that one. That's one that we've had on our to-do list. Tiffany Hendricks, Weimar Arbor State. With other states changing their death rates to reflect dying with versus dying of COVID-19, how can we be assured the deaths reported in Nebraska are accurate and our death rates are not inflated? So the way this works is that the doctor or the medical examiner makes that determination with regard to what the cause of death was. So they fill that out on the death certificate. Now that death certificate does allow for them to say the person specifically died because of coronavirus, but it also can say they died with that condition, that they had it as well. We leave that up to that doctor or that medical examiner to decide what the cause of death was, and we'll report what they decide. So that's what we've been doing at the state, really leaving it up to the doctor or the medical examiner. There are all sorts of standards and procedures or rules with regard to how they're supposed to make that decision. So there are published guidelines out there for how those doctors and medical examiners do that. Then they're supposed to be following those guidelines, and then we're going to report what they actually decide. If the goal to reopen lies on not overwhelming the healthcare system, what has been the hospitalization rate of those tested positive? So the current hospitalization rate for those testing positive is about 4.8%. Put that in perspective, over a month ago, it was over 11%, and that makes sense, right? If you think about it, the number of people going to the hospital is actually not going to change. But when this emergency first started, we were really only testing people who were presenting to the hospital. So of course, by definition, if you're testing somebody who's at the hospital, your hospitalization rate is going to be higher. As we've expanded testing, then we're catching more people who either are not going to the hospital or may even be asymptomatic, but are testing positive with coronavirus. So one would expect that that hospitalization rate would drop as we expand testing, and that's exactly what's happened. Hospitalization rates have dropped across the state to that 4.8%. And just so you know, that is also in line with what the folks at UNMC said the hospitalization rate would be based upon the experience they saw in China. So that was the number they kind of gave us when we first started talking about this at the beginning of March. So just kind of an interesting fact that actually proved to be accurate. With our positive rates rising at the same time mass testing has rolled out, how can we know that we are actually on the increase compared to when we had very low amounts of testing happening? Won't more testing naturally result in more positives? Is it possible infection rates are level or dropping without mass testing data from earlier the month compared to? So, Tiffany, actually, you nailed this on the head. That's exactly why I say looking at the number of cases is really not a good measure. Because as we test more, we will get more positives. And again, if you're testing folks, as we've been doing more broad-based with, say, things like testnebraska.com, we've been getting a lower test positive rate. So that's why, again, if we look for testing rates, the percent positives in pockets to see if that might be an early indicator that we've got going to have an issue for our hospital system, but we're not using that as a sole measure for how we're determining whether or not we're reducing infection rates. And actually, if you look at the percent positive, our percent positive rates, those have been dropping throughout most of the state in different regions. So we actually are seeing those rates decline. But you've exactly hit the hit the nail on the head as to why we don't use those cases as a good reason for how we're thinking about what's going on in the state. We look more at that hospitalization rate because those people are going to go to the hospital whether they are tested positive for coronavirus or not. That's a real indicator of what's going on. Hervanik from KRGI. What authority, if any, do communities and mayors of those communities within the health department region have when it comes to reopening? For instance, the rural communities of Wood River, Cairo, Doniphan all have seen the nearly amount of COVID-19 positive cases, but are suffering simply because they fall within the Central Health District, which happens to be also where Grand Island and Hall County are. Do they have any options to assist their local economies? No, they do not have the ability to do something that is less restrictive than what is going on with regard to the DHM in that public health district. So, and again, part of that is those communities are close to Grand Island. We're managing this as a public health district to be able to assist those public health directors in making good decisions about how we're protecting people broadly. So they do not have that ability to do something that's less restrictive. If daycares are able to increase the number of children of their approved license capacity to 15 kids a room, can the 10 student limit be increased to 15 for school weight rooms beginning June 1st? Tyson, just stay tuned on that one. We'll have more guidance with regard to that, so just stay with us. We'll have more information on that. Chris Stoom, NTV. A recent Federal Trade Commission report states that some nursing homes and long-term skilled facilities may have required their residents who are on Medicaid to sign their stimulus checks over to the facilities, claiming that stimulus checks count as a resource under federal benefit programs that must be used to pay for services. So again, getting back to the Medicaid program, Medicaid is meant to, again, help people that have low resources, they don't have any income, they've used up all their, all their savings. For example, if you've got savings, you can't get into the Medicaid program to have that pay for your long-term care. So while I've not had anybody talk to me specifically about this, the fact that folks are getting checks, resources, that they have to use those resources then to pay for their services under Medicaid makes sense. We can certainly run that down and find out what all the rules are, but that would absolutely make sense that, again, Medicaid is a program for people who cannot afford to pay. If you can afford to pay, you're not supposed to be covered under Medicaid. Does that make sense? So Ryan Boyd, KGFW, at the end of 2019, we were in phase 1 trade agreement with China, and some might say things were looking promising for Nebraska and the U.S. as a whole from that. Due to COVID-19, do you believe our trade partnership will change with China, or is it too early to make that statement? Early to make a statement on that matter? I'd actually been in conversations with the Office of our U.S. Trade Representative about a month ago, and at that time, they felt like even with the pandemic, China was going to be able to meet its obligations with regard to buying agricultural products from the United States. So now, granted, that was a month ago. Things may have changed, and of course, things can change really quickly in this whole pandemic anyway, but at least at that point, the federal government felt like China was still going to make its commitments with regard to the purchases of our agricultural products. Aaron Hegarty, KMTV. What's the latest count you have on coronavirus cases in long-term care facilities? How many affected facilities? How many residents who have tested positive? Employees recovered? When you count a facility as affected, does it mean it currently has a COVID case, or did it at any point? And actually, we need to get an answer on that last one. Taylor, where'd you go, Taylor?
I'm right here.
Taylor, did we know, I think it's just total if you've been affected at any point. Is that correct? The numbers I'm about ready to read?
Correct.
I think that's correct. Okay. So with regard to the nursing home data, 380 residents, 62 deaths. That did not change from yesterday. Again, part of some of the confusion is when I gave out a number that was people who had been reported that to have been a fatality because of coronavirus, but we actually need to get the death certificate and get that verified. And so that's why this number, 62, is lower than what I was talking about last week. So, and that number hasn't changed this week yet. So 62 fatalities. 280 staff. We've had 89 facilities affected, 53 that are only staff only, 7 with residents only, and 29 with both staff and residents. The CMS yesterday said they'll be releasing coronavirus case information for each certified facility in an online nursing home compare tool later this month. Given it's only been the state's position to release only aggregate information, not the names of affected facilities that have been required to report to local health districts, will this change now that the federal government is planning on releasing information on each facility? So we at the state are not actually going to change what we're doing with regard to this. Again, if local public health departments want to release that information, and they need to confirm with the affected facility employment and things like that. I would also just caution that the federal government data can sometimes be significantly out of date. So for example, we had an issue with this a few weeks ago where one of the federal government websites, I think it was the CDC, was reporting 21 fatalities in Nebraska when we had a number that was much higher. But the disclaimer on that page is that the data could be up to 8 weeks old. So I'm just caution that I think the expectation from people here is that it's going to be pretty much simultaneous, which is why we asked local public health departments to make sure they're confirming any information to make sure it's accurate. Leanna Ellis, Enterprise Media Group. Will the governor give any guidance to villages and cities regarding opening of pools for the summer? Will restrictions be lifted to allow pools to open this summer? So again, I would say just stay tuned. We've had phone calls with this with regard to the villages and the cities. I know this is a concern for them. We are working on that, so I'd say just stay tuned for it. We will have some more information on that as we get closer to the end of the month. And Taylor, do you have questions that were texted out?
Michael from the Dakota County Star would like to know, he says the numbers indicate that we've achieved our goal of flattening the curve. How much longer will we have restrictions on small businesses that impact the economy?
Michael, the Dakota County Star says, if you look at the data, it seems like we've accomplished our goal of flattening the curve, and how much longer will we have restrictions in place that are going to be impacting small businesses? So again, what we want to do is we've preserved that healthcare system, right, that hospital capacity. So we've been very successful in that. What we're going to do is start taking steps to loosen these restrictions like we did starting May 4th to be able to allow, for example, restaurants to start having dine-in with capacity restrictions. And we will continue to take those steps to loosen restrictions as we continue to have a stable hospital system and as we look forward in June. So now how long will we be doing this? Well, until there's a vaccination, we're going to be managing this virus until then. So this is something that people should be thinking about, that we are going to be needing to do, I'm guessing, until at least the end of the year. Obviously, the administrations have been talking about maybe a vaccine available somewhat sooner than that, but we're going to be managing this for the rest of the year, so we're going to be doing something. Now, obviously, we want to loosen these restrictions to the point where we're managing this in a way that preserves that hospital capacity and allows as much of a normal return to life as possible. But again, want to set everybody's expectation. We've been doing this for a while. We're going to look to loosen these restrictions gradually, a little bit at a time, to make sure we don't impact that hospital capacity and try to let people get back to a more normal life. And this is, again, where the testing and contact tracing is so important, because the more we can focus on the people who have been infected and get them to isolate and quarantine, the more we can let everybody else go back to a more normal life.
Melanie from the York News Times is asking, is there a projected date in which you'll be announcing the new directed health measures for June?
Melanie, York News Times wants to know, is there a date that we're going to be looking to do to announce the directed health measures for June? I would say just stay tuned, Melanie. We don't have a date that we're ready to talk about that. Again, remember what I said is we started loosening restrictions May 4th. We need 2 weeks. That was yesterday. So now we got that 2 weeks of data that we can go back and look at. But just kind of stay tuned with us here as we kind of process that information, think about what our DHMs are going to be. So I don't have a date I can give you right now, Melanie, but we will be getting back to folks with regard to that June, the month of June, and what sorts of restrictions we'll be loosening.
Sarah Kirkley with NTV has 2 questions. One is, how long can people drink alcohol at a restaurant before they get kicked out? And also, she says that restaurants want signs for their customers.
So Sarah Kirkley from NTV wants to know, how long can a customer go to a restaurant and order a meal and drink alcohol before they get kicked out? And again, I think that would be something that is going to be up to the restaurant's determination on how long they want somebody to take up a table. For example, I think there might be restaurants who are setting the expectation that you're limiting how much time you're spending in those facilities, or when you come to a restaurant, that you got a certain amount of time to eat your meal, and they want to turn that table over because they're limiting capacity. And the second question was, they want signs for their customers. I guess I'm not following what that means.
She says that people are confused about how to obtain signage on guidelines.
People are, okay, so part of our guidelines, the DHM, is that you had to post the DHM in your restaurant and those guidelines, and restaurant owners are looking for how they can do that. They just go to our website and print those 8.5 by 11 pieces of paper off and post them there. That's a way to be able to do it, or they can make up their own signs that keep the same information.
David Earl says the Omaha Chamber is reporting that they need enough coronavirus testing that we can capture asymptomatic cases. Will that ever happen, and how close are we to that?
So David Earl's saying the Omaha Chamber is saying that they want to have enough testing to capture asymptomatic cases. And how long before we have that? Well, again, part of what you see with regard to testnebraska.com is that when we're doing the testing there, we may be capturing people who are asymptomatic if they're a healthcare worker, working in the food processing industry, or a first responder, because we're not making symptoms a qualification for those folks to do it. Obviously the Omaha Chamber it's really kind of up to them to decide how they want to manage what advice they're giving to their members. But we are going to be continuing to look to expand testing. We've, as I mentioned, went from 22,200 tests over the course of last week up from the 13,300 tests the week before that. So we're going to continue to look for ways to be able to expand Test Nebraska, and I would encourage the Omaha Chamber to get all their members to push out the testnebraska.com website and have all their folks sign up.
Steve White wants your reaction to the president's announcement of the relief package for farmers. He says farmers and ranchers university say they like to reproduce for the market, not government programs, and is this relief needed?
So Steve White, NTV, wants me to react to the president's announcement with regard to the relief package for farmers and ranchers. I know the president was planning on doing something. I have not had a chance to see what that package is, and I know our farmers and ranchers would much rather have a market to be able to sell their goods into rather than getting government relief programs. However, I do think with what's happened with commodity prices as a result of this pandemic, that relief is needed, and I appreciate anything the president can do for our farmers and ranchers.
President Trump mentioned ending trade deals that import cattle. Given the value per head exports bring to Nebraska, would you ask the president to be cautious about that? So
again, I haven't seen what the president was talking about, but Steve is relaying that he talked about ending importing cattle into the United States. And so, yeah, I would certainly ask the administration to be cautious about that, because, again, there's a whole supply chain that goes on with regard to the cattle industry. So we export very high-end, high-quality cattle to the rest of the world, but we also bring in cattle that is would go into, say, hamburger meat, where you're not necessarily looking for the top quality cuts to be able to go into that. So there is a whole supply chain that goes along with this that I think we want to make sure that whatever we do, certainly I appreciate the efforts to protect our ranchers, but we also need to be mindful of what that's going to do to the entire supply chain system.
Ryan Boyd from KGFW wants to know if we're looking at loosening the restrictions of the Central District Health Department because the number of cases is going down.
Ryan Boyd from KFGW wants to know if we're looking at loosening restrictions in the Central Public Health District, because, again, this is where Hall and Grand Island are, probably the most heavily impacted part of our state. And are we looking at loosening restrictions? I would say we've got ongoing dialogues with Mayor Steele and Teresa Anderson, who's the local public health director, with regard to that. So, again, stay tuned.
Grant Schulte wants to know what you think of the business survey findings. Is there anything the state should be doing in reaction to it?
Grant Schulte wants to know what we think of the business survey findings, and is there anything the state should be doing about it. And again, that's what I said. Tony Goins will be using the information in part that's in the survey as he starts crafting his plan for how we get Nebraska growing again. So this will be information that we use as part of the overall picture of the steps we need to do to be able to help Nebraska businesses recover and get us back on that path.
And then finally, Charlie Brogan says you've indicated that Test Nebraska data is not being sold, et cetera. What about the DNA samples that are being collected? Are they being added to databases or shared with immigration or law enforcement, et cetera? So the question was, Charlie Brogan says we're not selling the data. What about the DNA samples? Are they being given to law enforcement or immigration? The answer is absolutely not. And all the information we collect with regard to testnebraska.com is only being used for this Test Nebraska program. So we are not doing anything else with that information with regard to test results or the DNA or anything like that. It is all being used for just testnebraska.com. That's all I got. Okay, great. Folks in the room. Lee.
You mentioned that the information will be turned over to Tony for kind of what he'll do with it, but can you kind of just give like a candid answer on 90% or so of the state's businesses have been affected? I mean, that's a large percentage of the state's revenue, everything that we see. Can you kind of just talk about the 90%, how much drastic that is?
Yeah, I mean, the survey puts into quantitative terms what we all know, right? Which is that business has been dramatically impacted by this. That even businesses that have continued to be able to sell have seen that they've had to make changes, whether it's how their customers are coming into their businesses or seeing customers being slow to make purchases. It is something that we know is impacting. The 87% of businesses being impacted negatively really demonstrates how wide this problem is. I mean, this has a huge impact on Nebraska businesses, and what the survey does is really, quantify what we all kind of qualitatively already know.
Question for Kathy Meyer.
Yeah, Kathy, can you come up, please?
What has been the biggest surprise to you of the information you've gotten back as a result of this survey?
I think that, as the governor mentioned, I think those of us who are working with businesses across the state have had our finger on the pulse of how they are feeling. I think to see it in quantitative terms so that we can actually analyze it has been really insightful. For the ecosystem, I think what is very helpful about a report like this is it allows us to figure out what we can do individually in our programs, but collectively as an ecosystem to help support businesses. So the governor was talking a moment ago about the reopening, and there's great information that's come from the state of Nebraska for those industry sectors that are regulated by the state. But what about all the small businesses that don't have an entity that sort of oversees what they do? How are they opening? And so chambers, economic developers, the Nebraska Business Development Center, all are posting on our website ideas and concepts to allow businesses to figure out the best way for them to reopen. And then what I would say to our consumers across the state is to be patient and respectful of our business owners as they are trying to navigate both the safety of their employees and themselves and the safety of their customers. And it's an incredible balancing act that our small businesses are navigating right now. And so I think we have to be incredibly patient and respectful of what they're trying to do. The other thing that's out there in our state is incredible ingenuity and innovation about how to keep your business going. Our team at the Nebraska Business Development Center talks weekly, and the stories that we're hearing from our clients and from other businesses about the way they're trying to do business is absolutely inspiring. So our businesses are out there and committed to trying to keep things going. And so you can see that in some of the report information that's there.
And you said one of the purposes of this was to make recommendations to policymakers. Is there one that has bubbled up to the top that you can share?
So thank you, Fred, for that, because what it's not doing is really making recommendations. What we're trying to do is lay out information that businesses are providing us so that policymakers can consider that information. So this report is really a broad report for policymakers to be able to look at and then think about what are the tools we currently have in the state. Again, each of us in the ecosystem is thinking about what we can do with our current resources to respond to what we're hearing from businesses. We are all very excited for the second survey because it's going to sort of give us that longitudinal picture about what our business is doing, how are they reacting, and how have some of the programs that have been provided supporting them currently. So we're very excited for the second go-round on the survey.
And so while you're up there, I had a couple questions. You talked about how businesses are working hard to maintain their employees and their employee hours. Can you give us some statistics on that or some data that backs that up? And do you have any numbers on how successful they are, how many businesses are doing that? Or what?
So we do have some information on
Kathy,
what the yes, sir.
repeat the question.
Oh, yes, thank you. What are businesses trying to do right now to help maintain the number of hours and number of employees they have? What are we seeing in the report in terms of data that helps to prove that out? What we know from this point in time survey is that they were having impact to their revenue and that they were trying to maintain the number of employees they had and the number of hours they had. That we know from this survey. What will be interesting is from the second survey, is there a shift in that? The other thing we also know is that the programs that have been provided so far from the federal government, whether that's PPP or EIDL through the Small Business Administration, has been intentionally targeted to help businesses maintain employees and numbers of hours. So we believe that we will see in that second survey, how have those programs helped them? Did those programs help businesses do exactly that?
And you said the top concern was that this pandemic would decrease citizens' confidence in their spending?
So
Or what are they saying?
so-
People aren't gonna come back through the door again?
So one of the questions that has been asked is what regarding the consumer confidence relative to the top concerns that were expressed by business, and that was the third concern expressed. I'm sure businesses are very concerned about when will customers be comfortable coming back into my establishment and doing business with me. And you can imagine in that period of time, April 15th to 24th, every business was asking that question. Now, as things have started to change, what will we see when we do the resurvey in early June as things have opened up? Will they be feeling more confident about consumers coming back? But it is an incredible challenge as these businesses are reopening their doors to their customers.
What are some of the, sorry, one more for you. What are some of the, you said that it's a challenge as these businesses are reopening the doors. Did you hear them specifically what is challenging? What are the different challenges they're facing in trying to do that?
So the question that's being asked is, are we hearing from businesses about the challenges that they are facing? And the answer to that question is we are hearing that. So I can speak specifically for the clients that we serve at the Nebraska Business Development Center. Our consultants across the state are sharing any and all resources that we are seeing with those businesses to help them consider for themselves what is the best way for me and for my employees to open our doors to our customers. And so we've been sharing the ideas that businesses have shared back to us about whether they're requiring masks, how many people are they allowing in their store, and how are they navigating that. And so we are doing that across that entire ecosystem. We know communities are doing that. We know chambers are doing that. And so for a business to look out onto the web and go to the Nebraska State Chamber of Commerce and Industry. They have a number of guidelines that help businesses consider how to reopen. We are doing the same on the Nebraska Business Development Resiliency page. And so we're all trying to share those resources in as many ways as we can so that businesses have the easiest access to that information.
Thank you, Kathy. Other questions? Yeah, Paul.
Can you run by those nursing home numbers again? I want to-
Sure. Give me a second. 380 residents have tested positive, 280 staff, 89 total facilities have been affected, 53 with staff only, 7 with residents only, and 29 with both staff and residents,
And 62 deaths.
and 62, yes, fatalities.
And just to be clear, are you saying that if the death certificate says the cause of death was COVID, then they're counted as a?
Right, so the doctor or the medical examiner makes a determination on the death certificate, whether or not it was coronavirus related, and if they say it was coronavirus related, that's how we count it.
So it would include the number of people that had it with COVID.
So again, we're picking up whatever they say. If they said that was the leading cause or that was the cause of death, then that's what we're picking up.
So I keep getting questions from bar owners and group of kind of people I run into, and they go, how come we gotta shut down, restaurants can open? They think some places are kind of gaming the system by, maybe they have a hot dog roll and that's all they have. What can you tell them about why they are forced to shut down in these maybe makeshift restaurants or not?
Sure, so the question was, why bars and not restaurants? So again, it gets back to, we're looking at avoiding large groups of people gathering. And if you think about a restaurant, people generally go into a restaurant, they sit down at tables. And so, again, remember, but neither one were allowed to have dine-in or bar-in or whatever we call it. Initially, we, as a first step at the beginning of this month, we said we relaxed the restriction on restaurants so that they could have 50% of their capacity, but no in capacity for bars, as taking a step on this program. So first of all, I'd say to the bar owners, that's a step, right? This is not something that's permanent. It's a step as we make sure we preserve that hospital capacity by doing this a step at a time. If you think about bars, they have lots of people that are not sitting at tables but have standing capacity, right? So there's people standing in those facilities. They have people at bars and so forth. So it's just it's an environment that is much more conducive to spreading virus. And so that's why bars were treated differently from restaurants. Now, you mentioned something about maybe some bars are trying to game the system. If there is a bar who is serving food they're not supposed to be, then please let us know. But there's no system to game. It's either if you are an establishment that has a food license, I think that's permit number, it's a 01 on your permit, then you are allowed to be open. If you are a bar or an organization that does not have that food license, you only have a liquor license, then you are not. You can't, if you don't have a food license, you can't just start serving popcorn or a hot dog and be open. That's the way it works.
I think they're saying it works the other way too, that they look down the street and they see a bar that serves some food, now they're only serving chicken wings, they're open till 2 a.m. Are they serving chicken wings till 2 a.m.? They don't think so.
So, well, again, if they think there's some of their competitors that aren't following the rules, then I would say go check them out, and if you've got a complaint, file the complaint with us, and we will, we can follow up on it. So, but what we're expecting is that people will broadly do the right thing, and I would say also just stay tuned. We're working on our guidelines or what we're going to do for June, so we'll look to take another step in June. And so we understand that, again, bar owners are feeling the impacts of the restrictions we're putting in place. We understand that, and we'll be looking to take other steps as we go into June.
Time for one or two more questions.
Yeah, Lee.
There was that talk about the survey further in June. Can you kind of give some hopes or expectations? You've lifted a lot of restrictions for places to reopen. From now till then, what you're hoping to see in the expectations from that second round of survey, what the numbers may or should look like?
Well, again, it's going to be difficult to know what a survey may look like, given that we still even haven't announced what our changes for June are going to be. So I'm going to defer on that. I really don't know what the survey will look like. Hopefully, though, we can take additional steps to loosen some of these restrictions and will allow people to get back to a more normal life. And that hopefully will be reflected in the survey, but it may be too soon for that survey to reflect it. John.
On the evictions, were you hearing from landlords or housing management companies, anything like that, saying that they need you to get rid of this executive order to make sure that they can pay their bills?
Well, we get a lot of feedback from different groups with regard to all of our issues, including the ones on evictions. In our estimation, again, given that the pandemic unemployment assistance out there is $600 a week, and that we are catching up, we cleared 2/3 of the backlog we had, from that first week of April, and all the other resources that are out there available. We were concerned that we didn't want renters to fall too far behind on the rent, because the further you fall behind, the harder it's going to be able to catch that up. So that was one of the things that weighed into our decision. We got feedback on both sides with regard to that, but really being concerned about renters falling too far behind was one of the main drivers for why we wanted to set that expectation that people need to continue to pay their rent, especially since the pandemic unemployment coming out there with $600 a week was going to be available.
Last question.
Last question. Yeah.
Will there be more surveys done after June, or will that be the last one?
So Kathy, will there be more surveys done after June?
We may do one in the fall, sir.
We may do one in the fall. So yes, there may be additional surveys in the fall. Again, folks, thank you very much for coming here this afternoon to talk about what the state is doing to fight the spread of coronavirus here in Nebraska. I appreciate all of Nebraskans' work to be able to follow our 6 rules and to slow the spread of the virus here in our state. Thank you so much. Your sacrifices have been working. We're all going to get through this together. Please stay tuned for what we're going to do in the future with regard to loosening some of these restrictions to allow people to get back to a more normal life. We'll see you either 5 p.m. tonight for the Spanish language briefing or 2 p.m. tomorrow for the English language one. Thank you.